Bismillahirrahmanirrahim. Assalamu alaikum dear students. Welcome to your channel The Anatomy Canvas. Today we are going to start with the histology of the endocrine system. So main objective of the endocrine system histology are to enlist the histological differences between anterior and posterior lobe of the pituitary gland and the pineal gland, the microscopic picture of the thyroid and parathyroid gland, and differentiate between the various histological zones of the adrenal gland. So in today's class we are going to discuss with the histology of the pituitary gland and the pineal gland, and in the next classes we will continue with the thyroid, parathyroid and the adrenal glands. So gross structure and developmentally the hypophysis are the pituitary gland. This is a pea-sized compound endocrine gland located in the sella turcica, that is a depression in the bone, the sphenoid bone in the brain, and it weighs about 0.5 grams in the normal males and 1.5 gram in multiparous women. So developmentally it arises from the two different sources: the glandular epithelial tissue, which arises as an outpocketing from the Rathke's pouch of the pharyngeal foregut, and the neural tissue derived, the neurohypophysis, derived as the downward growth of the floor of the fourth ventricle, that is the diencephalon. So embryologically it has two different origin, and this is the space where it is present is a compound endocrine gland, which is pea-sized, about the weight of 0.5 gram in males and 1.5 grams in males, and this is the master gland of the human body. So pituitary gland, structurally the pituitary gland consists of two different zones, that is the adenohypophysis and the neurohypophysis. So adenohypophysis consists of the pars distalis, which is also called the anterior lobe. It develops from the anterior part of the Rathke's pouch. Then the pars tuberalis and pars intermedia. The pars tuberalis develop from the lateral wall of the Rathke's pouch, and pars intermedia is the part that abuts against the infundibulum. So neurohypophysis, which form as a downward growth from the floor of the ventricle, fourth ventricle, forms the infundibulum, which is the stalk, which is continuous as the median eminence, and the pars nervosa. This pars nervosa is also called the posterior lobe of the pituitary gland. So developmentally this is anterior adenohypophysis, and this one is the neurohypophysis. So the superior hypophyseal artery is supplying the infundibulum, the median eminence, and then the pars tuberalis, and the inferior hypophyseal artery which supplies the pars nervosa. So what about the supply of the pars distalis? So pars distalis is supplied by the hypophyseal portal system. The artery, superior hypophyseal artery, which is supplying the infundibulum, the median eminence and the pars tuberalis, then break up into the system of the capillaries, forming the primary capillary plexus. These primary capillary plexus then form the hypophyseal portal veins that run along the infundibulum and enters the pars distalis, and in the pars distalis then they again break up into a second capillary network, that is the secondary capillary network, where it supplies the anterior lobe or pars distalis of the hypophysis cerebri. So this is the circuit from where the neurosecretory granules, which are carried to the infundibulum from the hypothalamus, are carried by way of the hypophyseal portal vein into the pars distalis. There are some other short portal veins which travel from the pars distalis to the pars nervosa, and they bypass the systemic circulation, and they have a negative or positive feedback effects on the different hormones which are secreted into the pars nervosa. So this is the sagittal section through the brain, showing the different parts of the hypophysis cerebri. This is the pars nervosa, which is the posterior part. This is pars distalis, which is anterior lobe of the pituitary. This is pars intermedia, then the pars tuberalis, and then the infundibular stalk. So this is a histological sagittal section of pituitary gland, stained with H&E staining, and in this diagram you can see this is the pars distalis or anterior lobe of pituitary. This is pars nervosa or posterior lobe of pituitary. This area is pars intermedia, and there is the infundibular stalk. So first we will study the adenohypophysis or pars distalis. In adenohypophysis we are looking into the slide of the pars distalis. So pars distalis is having basically three types of the cells in it. These are the basophils, the acidophils, and the chromophobes cells. The 40% population of the cells in the pars distalis are the acidophils, which is stained with eosine, and the 10% population is that of the basophils, which is stained with the hematoxylin, and 50% population of the cells are the chromophobes, which are paler in color and do not stain with either eosine or hematoxylin. So as this is an endocrine gland, here the cells are arranged in the form of the cards or columns, and in between these cards you can see the network of the capillaries. These are larger fenestrated capillaries which are present in between these cards and clumps of the secretory cells of the pars distalis. According to cell types, according to type of secretion, there are the two types of the acidophils. One are the somatotrophs, which makes 50% total population of acidophil. They are smaller in number and they secrete the growth hormone. Other are the lactotrophs, which are 15 to 20% of total population of acidophil, and they secrete the prolactin. Then the basophils, we have three different types of the basophils: adenocorticolipotrophs, gonadotrophes, and the thyrotrophs. So adenocorticolipotrophs are 15 to 20% total population of the basophils, and they secrete the adrenocorticotropic hormone and lipotropic hormone. Gonadotrophes are the small basophils. They make 10% of total population and they secrete FSH and LH. And thyrotrophs are large basophils making total 5% of population of the basophils, and they secrete the TSH. So acidophils secrete growth hormone and prolactin, basophils secrete TSH, LH, and FSH, and ACTH and chromophobes are undifferentiated cells. Actually, the chromophobes are the cells which have secreted their secretory granules by exocytosis, and their cytoplasm is now empty, so they do not take any stain. So here is the diagram of the adenohypophysis, in which you can see the acidophils, which make up nearly 40% of the population. Then you can see the basophils. These are the cells which stain dark with the hematoxylin, making 10% of the population. And then 50% of population are these chromophobes cells, which do not take any stain. They are pale staining cells. These are all the chromophobes. This is the section at low magnification of the adenohypophysis, which show red-blue color on low power because of the acidophils and the basophils which are present in it. Another slide with the trichrome stain, in which you can see the chromophobe cells which are pale staining or do not take any stain, the acidophil which are orangish in color, and the basophils whose cytoplasm stains with the bluish color. In this you can also see these are the basophils whose cytoplasm is bluish color in the trichrome stain, and then the chromophobes which usually pale staining or do not take any stains. Another slide in which you can see these are the eosinophils, and in addition the chromophobes are present over here. Here you can see the basophils as well as present. These are the larger capillaries which are containing the RBCs, and here you can see the red blood cells, colloid as well. So this is another diagram. This is the both of these are sections from the pars distalis of the adenohypophysis. But this section showing you large number of the acidophil in this slide, and this section showing you large number of the basophils in this slide. This is another slide. Here you can see this area is the pars intermedia. This area is pars distalis, and this area is at the extreme right is the pars nervosa. So in pars intermedia, small amount of basophils and eosinophils are present. In addition, larger capillaries are also present, and the cystic spaces are also seen in this slide. Another slide showing you the adenohypophysis, in which you can see the acidophils which are present over here. Large number of the chromophobes cells are present. In addition to chromophobe, small amount of the basophils are also present in this slide. So another section you can understand, this is the sagittal section of the pituitary gland. Here you can see the pars nervosa as well. So histologically, pars nervosa is formed from the downward growth of the fourth ventricle, and it contains the axons and the axonal terminals over here. And the only cell type which is present in pars nervosa is the pituocyte, which is irregular in shape, having many cytoplasmic process, and considered as one of the type of the glial cells. So here you can see the slide of the pars nervosa. Here you can see large number of the axons which are present. Here you can see herring bodies. Herring bodies are actually the dilated terminals of the axon, which contain the secretory granules. So this is again another MCQ as well. And the only cell types, the nuclei which you are looking in this diagram, are the nuclei of the pituocytes. So next is the pineal gland. Pineal gland is a neuroectoderm of the posterior portion of roof of diencephalon. It is a cone shape, flattened structure, secrete the hormone, the norepinephrine, the dopamine, the serotonin, melatonin, somatostatin, and thyrotropin releasing factor. So corpora arenacea are the basically calcified concretions which are present in pineal gland, and this is a very important point from the radiological point of view, because in radiological studies like X-rays and the computer tomographies, it is a convenient marker, serves as a convenient marker to identify the structure of the pineal gland. So this corpora arenacea is also called the brain sand. The human pineal gland relates to the light intensity and duration of the endocardiac activity, that is the circadian rhythm. This is important function of the pineal gland. So here you can see these slides of the pineal gland at low magnification and here at high magnification. Main type of cells which are present in this slide are the pinealocytes. In addition to pinealocyte, 5% of the population are the glial cells, and also you can see these are the corpora arenacea, also called the brain sand. This is the higher magnification of this calcified area. Also here you can see the pinealocytes and the small amount of the glial cells which are present over here. Another slide to the pineal gland. Here you can see the glial cells, the pinealocytes, and the blood vessels which are present. Another slide of the pineal gland. Here you can see pinealocytes which are present. In addition, astrocyte is also seen in this slide as well. So these are the references, dear student: the basic histology by Laikus and Siddiq, the histology text and atlas by John Quera, and histology text and atlas by the H. Ross. Thank you very much for your attention for the 2 days class. Inshallah, in the next class we will do the thyroid and the parathyroid. Till then, Allah Hafiz.